Hi, I'm Dr. Todd Fergus, interventional cardiologist from Green Bay, Wisconsin. Let's get right into it. Today we're talking about a heart arrhythmia or irregular heartbeat called atrial fibrillation. Now first let's start with a little anatomy lesson. So the heart is made up of four chambers. There's the two upper chambers of the heart, the left atrium and the right atrium, and then there's the two bottom chambers of the heart, the left ventricle and the right ventricle. It's the ventricles that do the majority of the pumping function of the heart. Now, atrial fibrillation is when those upper chambers, instead of squeezing rhythmically, just start fibrillating or quivering. And that has a few consequences, which we'll get into in a little bit. Now, what can cause atrial fibrillation? There are a few heart-related factors that can increase your risk of having atrial fibrillation, such as previous heart surgery, previous heart attack, previous coronary artery disease, previous valve problems. And then there are a few non-cardiac causes that can increase your risk of developing atrial fibrillation, such as tobacco use, alcohol use, being overweight, diabetes, and others. Now, atrial fibrillation is very common. About 5% of people over the age of 70 will have atrial fibrillation, 10% over 80, and about 20% of people over 90 will eventually develop atrial fibrillation. There are three main consequences of atrial fibrillation. One is rapid heart rates, two is stroke, and the third is symptoms. Now let's take them one by one. Now first of all is the rapid heartbeat, or what we call tachycardia. When those upper chambers are just fibrillating or quivering with a lot of disorganized extraelectrical activity, that can make the ventricles go very fast, and that's what tachycardia is. So oftentimes we have to use medications such as beta blockers, calcium channel blockers, or digoxin to get that heart rate down. Preferably, we like to see the resting heart rates under 100 with some exceptions. The second consequence of atrial fibrillation is stroke. When those upper chambers are just quivering instead of squeezing the blood out with each beat, blood can get kind of stagnant in there. Anytime blood is stagnant, it can coagulate or clot. Now, if a blood clot's just sitting in the heart, that's not that big of a deal, but if just a little piece of that clot breaks free, it could get pumped up to the brain and clog up a blood vessel in the brain, and that's what a stroke is. So most patients with atrial fibrillation need a blood thinning medication such as Coumadin, Xarelto, Pradaxa, Eliquis to prevent those blood clots from forming in the heart. There are some alternatives to these medications as well that we won't get into right now. Now, the third consequence of atrial fibrillation is symptoms. Some people have no symptoms at all from atrial fibrillation, and generally the older the patient, the less likely they are to have any symptoms at all. But other people, particularly younger patients, may have a lot of fatigue or shortness of breath or palpitations or dizziness or lightheadedness. And in those patients who are having symptoms, we work towards what we call rhythm control, where we use antiarrhythmic drugs, electrical cardioversions where we shock the heart to normal rhythm, or ablations, or a combination of two or three of those to get the patient back into normal rhythm and hopefully keep them there. So in summary, atrial fibrillation is a very common arrhythmia. There are several risk factors that predispose people to eventually develop atrial fibrillation. And if and when it does occur, we focus on rate control, stroke prevention, and possibly rhythm control. So that's it for the basics of atrial fibrillation. Stay tuned to this channel for more videos.